So thank you for joining us again, Professor Dominique. I guess one of the biggest questions that we have, it may seem very obvious, but what does NOSAÍS stand for?
That's a hell of a good question. NOSAÍS actually doesn't mean anything.
Okay.
Basically, it did mean something because I found the word looking for a word on the internet, and it's probably, I guess it comes from old Aramean language.
Okay.
And it means the goal, the objective, and something like that. But I couldn't find it anymore.
Weird. Have a look, and I did struggle to find what the meaning was. So that was one of the first things.
Well, there's nose in it, so that's fine.
Okay.
And I think it's nobody's gonna use that word, so
it's just yours. It's all yours, your personal thing.
Exactly.
Amazing. So one of our other big questions is, when we talk about the NOSAÍS project, how exactly did that come about? We know about the use of dogs for bomb detection and, like you said, banknotes and other uses, but this is specifically using them for medical detection.
Yeah, right.
So how did that start?
Well, I've been in the detection dogs for almost 40 years, and I've always kept that in mind, that dogs should be able to catch diseases, and there's some teams around the world that are working on that. There's one big team in UK, for example, but I just didn't have time to launch it. And then I went to Lebanon in 2017 to give lectures, and a friend of mine who is a surgeon at the St. Joseph University in Beirut, he's also a dog lover, and he's got a lot of dogs, and he came to me and said, why aren't we trying to sniff diseases with the dogs? And I said, okay, let's go, right? And so basically we started in Lebanon with colon cancers detection with his dogs, 6 dogs. Why did we start in Lebanon? That's another question. Well, if you're a vet and you want to have some positive samples of a disease, especially a colon cancer, it means that either during the surgery you take a swab and you swab the lesions, or you take the lesions off and you provide this to the dogs. To get the official authorization to do that in France, I think it would be a question of 3 tons of papers and 20 years, right?
Oh, wow.
In Lebanon, we could do that in 2 weeks and start, So
opportunity was there.
So this guy is a digestive cancer surgeon. So very quickly we had samples of the 5 different types of colon cancers. We could train the dogs, and we started the clinical tests, which means that the people coming for coloscopy, we asked them if they are okay to put a swab. I don't know the word in English, but I would call that the bottom cheeks, if you see what I mean.
Yes.
So you put the swab there for 3 minutes, and then you get the swab, put that in a plastic bag, and to the dog. Today, I think we have something like 500 people who underwent that process. The dogs have found 50-something cancers marked positive, and it perfectly fits with the ones coming from the histopathology after biopsy.
That was how you confirmed what the dog detected.
So it was a double-blind study, and it's 100% positive in terms of specificity and sensitivity. And to be honest, we presented that in conferences, but I don't want to publish now because I would wait for the dogs to miss 1 or 2.
Okay. Because 100% is
100% is not the good way to communicate. No.
Yeah.
So that's how it was born, and then came COVID, and once again I was in Lebanon. We discussed, and I said, okay, let's try on COVID because it's never been done. Can the dog detect an active virus on a human? So we started in Alfort. That was in early March 2020. And what's interesting is that on the 27th of March, I was caught by the Minister of the Interior and of the Emirates, and they asked me if I was okay that they work with us. And I said, yeah, of course. And then the World Health Organization came and they said, okay, we're gonna provide you with finance to do this. fine. And so at the end, we had around 60 countries that we were connected with, WhatsApp exchanges, videos, and so on. Every 2 weeks, we were making teams in order to exchange everything, organized by the Emirates and the WHO. And it did work, you know. So some countries used it. The Emirates, for example, they had dogs at the airport in Dubai. They had small trucks that were going to the villages to check the people. They had dogs at the border with Saudi Arabia and Oman. We've been working with, as I said, 60 countries, but Finland or Germany, they deployed dogs.
Quite international program has become.
But in France, I couldn't convince the authorities, so we couldn't deploy dogs, which is a real pity because the advantage of dogs, now we know, with all the meta-analysis that have been done, we know that the dog is at least as efficient as PCR.
I did read in one of the studies that actually they can almost detect asymptomatic patients 48 hours before a positive PCR. Exactly. That's actually a little bit more efficient than a PCR test.
Exactly. We made a one study in Paris with the Paris Hospital Organization. And this was asked by politicians to do it. And the doctors, the human doctors, they were just laughing, right? So they started providing us with samples. We didn't know what they were, just numbers. I had 4 dogs coming from the Emirates to help us. And we gave them the results. And at the end, on the sick people, the sensitivity was 97% with the dogs, and 94% in terms of specificity, but on the asymptomatic people, 100% of sensitivity and 97% in specificity. So then afterwards they became our lawyers because they were saying, well, human doctors were really amazed about the results. Well, it was obviously not enough, plus the fact that we had changed our training methods. At the beginning we were training with samples, sweat samples.
That was my next question. What specifically went into the training for COVID detection for
the
dog?
We on our side, we did work on 2 types of samples. One was the masks, and the other one was sweat from the armpit. But then afterwards, we started working with the Pasteur Institute in Paris, and they produced kind of a lure for us, which is actually a cell culture of the virus. And we take the liquid stuff on top, okay, and we use that to train the dogs. And this was more efficient actually than the sweat, because in the sweat or in the air, we have the volatile organic compounds, so small molecules. And with the lure, we also had the spike and the end proteins of the virus, because the virus were exploded. And it's interesting to see that, for example, unvaccinated people, with that kind of training, the people who are positive, some people who are positive 3 days after they've been vaccinated. This was not what the French authorities expected, obviously.
It's not, yes.
Because it means that, you know how the vaccine is working. So it means that if you inject RNA, you are asking your own cells to produce some spike proteins. And the spike protein, which is actually the bad one, is inducing an immune response, right? Yes. If you have some spike protein in the sweat 3 days after, it means that your immune response was not good. Right. Did it induce?
So how effective were the vaccinations? That's what that calls into question.
That's a good question. Yeah.
And what would you say about the dog's specific olfactory, capabilities that made it so well suited for detecting these VOCs in the sweat? Or
we could spend hours on the bug olfaction process, but clearly, journalists very often they ask how many times the dog is more efficient than the human, etc. I don't know, and I don't care, because depending on the odor, it can be 10,000 times more efficient or up to 1 million times more efficient in terms of a sensitivity threshold, right? So the dog is way more efficient. And what's been demonstrated is that a dog can catch a molecule at a concentration of 10 exponent minus 15 moles. The best machines the best mass spectrometer is able to catch a molecule at a concentration of 10 exponent minus 12. So it means that the dog is 1,000 times more efficient than the best machine, actually.
That's incredible.
So now, is the dog catching one molecule or a bunch of molecule, like a flower stuff? It's the bunch of molecule. It's not only one. And that's what's specific of the problem. And when we finished COVID, we're still working on long COVID. And once again, this was a problem in France because we published the first paper showing that more than 70% of the long COVID people were still tested positive by the dogs, which means that they are carrying a active virus. And this was against
to spread the COVID, essentially.
Yeah, but this was against the official theory that was this is a mental disease. Now it's clearly demonstrated that the long COVID people are still carrying the virus. Well, and then afterwards, so we said, okay, let's move to other diseases. And so actually we work on Parkinson disease. We work on bladder cancer. We just finished a program on high-grade prostate cancer, working on urine. We have a program on an animal disease, which is the dairy cow's mastitis. So in order to have the dog detect the positive cows when they are subclinical, so before they have the mastitis. We are starting something on melanoma with the Gustave Roussy Institute. That's the big institute for cancer in France. And the last one we are starting now is tiger mosquito eggs. Because the idea, it's not difficult to make a diagnosis of dengue on people. So it wouldn't be useful to have dogs detecting that. But if the dogs in winter in a country like France are able to catch the eggs of the vector of the disease, then we can destroy the eggs in winter, and there's no vector, and there's no vector, there's no disease. So we do that also with the Pasteur Institute. That's what we are doing, actually.
Amazing. When you talk about using the dogs for medical detection, let's say for COVID, there was multiple strains of COVID. Does that affect the kind of VOCs that come out of people? And how does that relate to the training in terms of how many times you have to reintroduce different types of samples dependent on the strain? Is that a challenge?
We've been testing that on 7 different strains, and so did the people working with us at the University of Hanover in Germany. And clearly the dogs that were trained on the first 2 strains were able to catch all of them. Yeah. So I don't know what it would be now.
Yeah.
But obviously, even if the virus is mutating and changing a little bit, it stays with the same categories of VOX, of volatile organic compounds, that the dog can catch.
It's a dog still reliable. There's not that limitation, let's say, which was some of the things that we saw with some of the testing. It wasn't able to detect all the strains, whereas the dogs seemingly were still very specific and sensitive.
Yeah.
To
the dog is never going to lie, That's the difference between the dogs and the machines sometimes.
Amazing. So, as well as using the dogs for medical detection, I think we did speak about the fact that you are a firefighter. And you are using these dogs for search and rescue as well. What can you tell us in terms of the detection for search and rescue, how that differs for medical detection specifically? Because it's quite different. It's interesting to know how the dogs are able to find missing persons that they seemingly never...
It is way, way, way easier for dogs. The dog handlers in search and rescue, they don't like when I say that, but... avalanche searching dogs or search and rescue dogs for rubble piles or lost people, it's not difficult because basically the human odors, they're not the same. We each have a code bar with our own odor, but the base is the same. The only thing we need to do, and it's no racism to say that, is that when you train the dogs, you need to train them on white people, on black people, on yellow people, etc., simply because we don't have the same glands in terms of sweat. Sometimes we don't eat the same things, and the odor that the dog is catching is coming from all this. And same, we need to train them on babies or on elderly, because a baby is 85% of water and an old person is 45% of water.
It smells so great.
So, but I mean, even us, we can smell a baby and an old person, and it doesn't smell the same. So that's what is difficult. Plus the fact the dogs are evaluating in a harsh environment. But a part of that, on a nose point of view, it's easy for the dog. It's really the way the dog is going to behave, try to go as close as possible to the victims so that the rescuers can work at the right place. This is the most difficult thing to obtain, but sniffing is not difficult, no.
Amazing. And you also touched upon, the fact that you did do some work here in the UAE with some of the ministry here. Can you touch on specifically what you were involved in and what they were able to roll out here in the UAE in terms of using your NOSAIS medical detection dogs?
Yeah, we had a group of, I think, 60 dogs that were trained here actually at the Dubai police facilities under control of the Ministry of the Interior. And they just made a great job. I mean, we just came a couple of times to help them, yeah.
Is it a long process to get these dogs to...
It's depending. If you have dogs that are used to the way they are going to work, it can be olfaction cones, or we have a machine to train the dogs that is just a marvelous stuff to gain time. With cones, you put 10 cones and the dog is going to sniff them. When it's positive, you're going to reward the dog. When it's negative, you don't reward him, etc., etc. But then you need to change the samples. So it takes time. In 20 minutes of training, the dog is going to sniff 40 times, for example. We have a machine coming from Germany that they basically use to train the dogs of the German army, where things are randomized, and you can pilot that with a tablet. You have 7 holes. Behind each holes, you have a positive and a negative, and it's moving. So the dog is going to sniff. If there's a positive, he gets his reward. Can be kibbles or it can be a ball. And immediately things are changing, and he can do it again and again and again. So in 20 minutes, he's going to sniff 600 times. So once he's got that way of working, well, to put a new odor in his nose, my dog, for example, and I promise you it's true, it's going to take less than 20 minutes. Less than 20 minutes. I mean, my dog has been working on COVID. She's been working on prostate cancer. Next time I'm going to put it, I don't know on what, but I know it's going to work very quickly. If there is an odor, that's the other problem. For example, the tiger mosquito eggs. We also have to work with Culex and Anophel eggs, the 2 other types of mosquitoes we have in France, and demonstrate that the dogs can specifically catch the tiger mosquito egg
between the different
compared to the others. If it works, it can go very quick. So for a dog who never did work with his nose before, because we only use dogs of our students at the vet school right now. It's depending on the intelligence of the dog. If the dog is clever, it's gonna take 3 weeks to get adapted. If it's not, that's gonna take 6 weeks. And then to put the odor in the dog, for the worst dogs, it's gonna take 1 week.
So when you came here to do this with the UAE, that was quite a quick process, and obviously a quite successful one because you had 60 dogs.
That's it's been. I think we've been publishing pretty quickly with their results, and then they immediately deployed. They were really, honestly, really efficient.
And what can we say is the future for these dogs? We've spoken a bit about, more medical detection that they can do. In terms of a One Health approach, what would you say the future is for NOSAIS and these dogs?
I'm getting old. That's one point.
Doing well though, still doing.
But the thing is, I'm 100% sure that humanity will use dogs to detect diseases in the future. Will it be in 15 years or 20 years? That's why I say I'm old, because I might not see it, right? But I'm sure this will happen, simply because the dog can be a mass detection system, even if I don't like the word, to pre-detect diseases that will enter the normal way afterwards. Okay? If you look at once again in France, there are 3 cancers for which detection is provided for free by the government: breast cancer, prostate cancer, colon cancer. How many people, what is the proportion of people who use this possibility of detection? 25%. What is the goal of the European Union? In every country, it's more than 75%. They will never reach 75% simply because it's painful sometimes. Biopsies can be painful. I mean, breast detection, probably it's also painful. It takes time, etc., etc. It takes time to get the results. And it's very expensive for the state, for the government. The dog, it's non-invasive. It's cheap. You get the results immediately. So all you need to do is to reward the dogs with kibbles or balls.
Seems like a no-brainer, doesn't it?
And my dream since the beginning is to say, well, in France we have 7.5 million dogs, right? If we convince 1% of the population, instead of going to a dog club or sport club to train the dog to sniff some coffee grains or spices just to show to their friends during the weekend that the dog is able to find a grain of coffee hidden somewhere, if they train the dog for one disease, okay? And if we have these dogs in the different departments of France, there's 100 departments in France, okay? And once a week they go to sniff disease samples. Well, it means that 75,000 dogs could be deployed. And it means that in each department you would have 750 dogs to serve the human health. It is a One Health concept, except it's a One Health concept reverse. The One Health concept, actually, it's the animal is bringing lots of diseases to humans. Well, yeah, okay. But here, the animal is able to help
save
human health. So this is why, honestly, we're a non-profit charity organization. And I'm having a hard time finding money. And I have to thank the SV group because you guys are helping us. But I'm having a hard time understanding why we don't get help from the Ministry of Health, for example, in France. I'm afraid it's because the lobbying of laboratories is very
strong,
efficient. But I do hope that in some countries they will understand that this is also part of the future. It's another kind of innovation. It's a new paradigm.
It seems like NOSAIS is the future, especially for cost, time efficiency, and also how specific and sensitive these dogs are to detecting things early in advance before the onset of disease, which is what you want to do.
Parkinson disease is a good example. We started that because I heard that one team was working on that at Washington State University in Seattle. So with my assistant, we went there. We tried to understand how they were working. They work on sweat, actually. And they do that because there's some proof and published proof that the quality of the sweat of Parkinson people is changing 5 to 7 years before the first symptoms. And so they take the sweat here and they train the dog with it. And it works. So we went back to Paris. We said, okay, we're going to try. And 3 months later, these people, they became friends, actually. They phoned me. They said, well, the person in charge is retiring and nobody wants to hold the program that she was holding. So do you want to do it? I said, well, yeah, of course, because we started. Okay, so we send you all our positive samples plus the money that's left on the program. And so now I have 8 dozen of our students working on that and discussing we collaborate with neurologists of the big hospitals we have around. And we say, well, if you tell us someone is positive, it is not going to help us treat the person. But what we can do is delay the first symptoms of 5 to 10 years. So if only a dog is able to give 5 to 10 years more normal life to a people that will finish Parkinsonian, of course it is positive.
It's a massive difference in the quality of life.
Yeah.
neurodegenerative disease, because you're just going to delay the onset.
It's the same for cancers, and I hope in the future we can also work on some other degenerative diseases like osteoarthritis and stuff like that. I mean, that I don't think there's any limit
To what they
in the dog's nose. So we'll see.
That's amazing. Thank you so much for joining us here today, and very excited to hear about the future of NOSAIS. I'm sure it will go very, very far.
I hope so.
Hopefully in the time that you're still working with them.
Thank you.
Thank you very much.